I did my presentation on heart and lung transplantation. A heart transplant is the replacement of a person's diseased heart with the donor's healthy heart. The donor can be someone who has died and whose family agreed to donate their organs. The heart transplantation process is listed in pictures below. The first step is that your heart is removed by cutting into the chest cavity and cutting into the pericardium, which is the outer membrane that covers your entire heart. The left atrium of your heart is left in place along with your pulmonary vein opening while the rest of your heart is removed. A patient's new heart will be sewn to fill the spaces of the old heart. The donor heart is connected by sewing the vena cava, aorta, pulmonary artery, and left atrium. And then medication is given to help you from rejecting the old heart when you get the new one. Causes of a heart transplant, 3 of the causes are congestive heart failure, coronary artery disease, and cardiomyopathy. For congestive heart failure, it occurs when the muscle is weakened and cannot pump enough blood to the body. When your heart doesn't pump enough blood, it causes blood to be backed up and fill the lungs, which causes congestion, and it also causes them to swell and turn blue from a lack of oxygenated blood. Coronary artery disease is the most common type of heart disease. It occurs when the arteries that surround the heart become hardened and narrowed. Cholesterol and plaque can build up on the inner walls, which is known as arteriosclerosis, and that decreases blood flow to the heart as well. Coronary artery disease can weaken the heart muscle, and it can lead to heart failure also. Lastly, cardiomyopathy is the disease of the heart muscle where the heart becomes enlarged, thick, and rigid. As it worsens, the heart becomes weaker and is able to pump less blood from the body to maintain its normal electrical rhythm. How the heart transplant affects the exercise response. The donated heart they received is decentralized. Since it's decentralized, it means that the autonomic nerve fibers are severed. Regeneration can occur after 1 year, but isn't very likely. Most of the time, decentralization is permanent. The myocardium is decentralized, which causes changes in the exercise response. The first is elevated heart rate. Instead of having a resting rate of 60 BPMs, your resting rate is elevated to 90 to 100 BPMs. This is because the parasympathetic influence is no longer present on the SA node. Second, slight changes in heart rate when exercise starts. Heart rate might only change a little at the start of exercise, since no sympathetic nerve fibers are present to stimulate the heart directly. During exercise, the heart rate will increase slightly due to the release of norepinephrine, but it might not increase by much. During peak exercise, heart rate lowers along with cardiac output and stroke volume, which are lowered by about 25%. And it takes longer to decline post-exercise. This means to monitor your client closely and also realize that heart rate might not change within the first 2 minutes, so to keep them on a treadmill or just monitor them. Management and medications. Pre-transplant, 4 steps are to follow a strict diet, don't consume alcohol or smoke, exercise daily, and visit the doctor regularly. So along with avoiding alcohol, it goes with the immunosuppressant drugs. It doesn't have good side effects. The immunosuppressant drugs and other medications might also reduce the body's function and immune system. 3 medications that are used to prevent rejection of the heart are cyclosporin, tacrolimus, and prednisone. So cyclosporin is used in lung transplants also. It's taken orally, and it allows the body to accept the new organs. Tacrolimus is immunosuppressant as well, and it blocks T lymphocytes and also protects the organ. Prednisone is a corticosteroid, and it prevents the release of a substance that causes inflammation. Exercise prescription. Testing might not be helpful in developing an exercise program, and patients should aim to spend 700 to 1,000 kcal a week as tolerated, depending on how quickly they recover. Aerobic mode, cycle, treadmill. You can also do water aerobics, walking, running. RPE, 11 to 14 on a Borg 20 scale. Frequency, 4 to 5 times a week, and duration, 40 plus minutes. Aerobic considerations is your goal is to basically improve your submax and peak endurance. Resistance training, free weights, machines, bands are all fine. Intensity, 40% of 1 RM for your upper body activities and 50% of your 1 RM for your lower body activities. Again, 1 to 2 times a week, 1 set of 12 to 15 reps per muscle group. That includes major muscle groups. Some resistance considerations is aiming to increase leg strength and endurance overall. Balance should also be emphasized to prevent sarcopenia and decrease bone mineral content. And prednisone can cause bone and mineral loss if taken for a prolonged period. So just keep that in mind if people are taking that and doing resistance training. For range of motion and flexibility, mode static, but you can also include dynamic or yoga. Intensity, I would hold the stretch until it hurts a point of tension. Frequency before and after working out, make sure they include this in their workout. And 5 minutes pre and 5 to 10 minutes post. That can be longer depending on how long they work out for and how sore they are. Other exercise considerations with heart transplants: increases in body fat can lead to obesity, and exercises should be taken into account the added body mass. Again, if your client is trying to do an exercise and they can't, maybe lower the weight or just realize that they might weigh more, so it might be harder for them to balance. Range of motion post-operation in the thorax and upper limbs may be limited for several weeks. I'll say this again in lung transplants, but they say to limit upper body lifting to 10 pounds or less within the first 6 weeks. And decentralization eliminates angina symptoms in post patients, but they still may be present, so just keep an eye on chest pain. Moving on to lung transplants. A lung transplant is a replacement of a person's diseased lung with the donor's healthy lung. So there's 2 types of transplants: cadaveric, which is coming from a deceased organ donor, and a living transplant, which is coming from a healthy, non-smoking adult. And you can do one lung or 2 lungs. The lung transplantation process: 3 types: single lung transplantation, double lung transplantation, bilateral sequential, and a heart and lung simultaneous transplant. Single lung is 1 lung, double lung being 2. Bilateral is the transplant of both lungs, done one at a time. It can also be known as bilateral single. And heart lung transplant is lungs are replaced first, followed by the heart. A heart and lung transplant can also be known as cardiopulmonary transplantation, and it can also be the end disease of both the heart and lungs. The simultaneous replacement of the heart and lungs will end with end-stage cardiopulmonary disease. The lungs are replaced first, followed by the heart, and on the bottom are just 2 pictures showing lung transplant on the left and heart transplant on the right. Causes of a lung transplant: chronic obstructive pulmonary disease, or COPD, cystic fibrosis, and asthma are 3 of the main ones. So COPD is characterized by increasing breathlessness. COPD is used to describe other lung diseases such as emphysema, bronchitis, and asthma, which we'll talk about below. Symptoms of COPD include coughing, wheezing, feeling like you can't breathe. Cystic fibrosis causes the cells in the respiratory system to absorb too much sodium and water. It also causes secretions in the lungs to be thick, which can put people at respiratory infections, put them at risk for respiratory infections. And asthma: inflammation of the tracheobronchial tree to a variety of stimuli. Upper airway responsiveness leads to episodes of coughing, wheezing, sneezing, etc. How a lung transplant affects the exercise response: so it increases shortness of breath while exercising. Keep an eye on that while clients are working out post-lung transplant. When muscle dysfunction can cause atrophy, and maximum capacity is of 40 to 60% after transplantation, so don't expect your client to go as hard as they used to, and keep an eye on them as well with their RPE. They might feel like they're working a little less hard than they are, but their heart rate might show differently. Management and medications. Post-transplant, kind of along the same lines as a heart transplant. Don't smoke and avoid alcohol. Again, can interfere with immunosuppressants or other medications they might be on. Continue cough and deep breathing exercises. The picture on the right shows you a device that can help with breathing exercises. Limit upper body lifting. So again, limiting that to 10 pounds or less within the first 6 weeks, protecting your thoracic cavity and anything in the chest. Strict diet and exercise regimens. Same with heart transplants, avoiding fat, salt, anything that might be fried, things like that in your diet. And visiting the doctor often for checkups, medication, further treatments, things like that. And medications are primarily the same as those used post-heart transplant. There's a long list of them in the book, but I didn't feel like going over all of those. So for my case study, I chose Judy. She's a 62-year-old client. She's fairly active since her transplant. Her transplant was 5 months ago, and she takes prednisone ever since then. She's 5'6" and weighs 143 pounds. She has no family history and is a non-smoker. Fairly healthy levels. Her cholesterol is 224, LDL 115, HDL 42. Her fasting plasma glucose is 83 with a blood pressure of 132 over 86. I put Judy with 2 risk factors, first being her age and the second being the medication she takes. I chose the medication because it can affect a lot of things and it can also depress your immune system. Therefore, she can get sick a lot quicker as if she wasn't taking the medication. So, solution of the case study, I broke it up aerobic, resistance, and flexibility. This goes along with the same heart rate or heart transplant prescription I gave earlier. So, aerobic, Judy should exercise 4 to 5 times a week. Again, 11 to 14 on an RPE 20 scale. 40 or more minutes, that can be broken down into 4 10-minute sessions, 2 20-minute sessions, or 1 40-minute session. Type walking, motor aerobics, cycling. She can run if she'd like. That causes a little more stress on the joints. Moving on to resistance training, frequency 1 to 2 times a week, 40% of 1RM for upper and 50% of 1RM for lower. 1 set of 12 to 15 reps working on major muscle groups. For Judy, probably mostly machines, but she can also do bands and free weights if she would like. Flexibility before and after workouts, definitely. She should hold or stretch to a point of tension, 5 minutes minimum pre, 5 to 10 minutes post. I would suggest static stretching. She can include dynamic if she'd like, and also some yoga on the side. In conclusion, heart and lung transplants affect a patient's life dramatically. They have to make lifestyle changes, which might be dramatic for some, and remember to take their medications daily. Especially for people who eat unhealthy and don't really exercise regularly, this could be a major change, especially things including the diet and having to cut back on salts, sugars, things of that nature. Patients feel the risk of rejection of the organ post-transplant. Not only does it affect the person physically, but it affects them mentally as well. They might not mentally be prepared to get back to exercise, along with being out of shape physically for being out for a little bit of time. And exercise post-transplant might be hard to get back into and might be different than when a patient exercised previously. They might have to limit their intensities or work a little harder than they did. Just remember to take caution with patients with transplants and monitor their heart rate and breathing a lot closer than you would someone who didn't just have a heart transplant. Again, going back to what I said, even though their RPE might feel like a 10, their heart rate might show differently. So monitor that and just be cautious. And at the end are my references.